So one injury I see a lot in my clinic are Achilles tendon ruptures, and oftentimes these injuries I'm treating surgically these days, just with the advances we've made with our techniques and just our surgical ways of repairing Achilles tendons. Now we can do them through very minimally invasive incisions, an inch or so, able to get a good repair with minimal soft tissue disruption, which leads to less pain, less swelling. Patients are able to rehab a lot quicker and get back to normal activity a lot quicker. So if you're a young, active patient or even older but still active, I'm definitely trying to push patients more towards having Achilles tendon ruptures repaired surgically. So if you experience any sort of Achilles injury, feel a pop in the back of your Achilles with activity, please don't hesitate to call our clinic and make an appointment to see me.